Good evening. I'm Dr. Robert Peppercorn, and this is the Yuba City Medical Explorer. As a specialist in skin diseases and allergy, and as host of this program, I will take you on an exploration of the medical communities of Yuba and Sutter counties and bring you behind the scenes of medical care practices right here in our local area. We bring you a fascinating program tonight as we explore a medical technique that has saved hundreds of thousands of lives in the United States during the past 2 decades. Our Channel 5 Medical Explorer cameras will take us behind the scenes of our area's kidney dialysis center. This exploration will give us the opportunity to view actual kidney dialysis and to meet several patients whose lives have been saved because of this miraculous technique of modern medicine. We will also meet a physician who has dedicated his career to caring for patients with diseases of the kidney and other areas of internal medicine. This is an extremely timely and very important subject, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. A warning has been issued for people wearing extended wear contact lenses. Extended wear or 30-day contact lenses cause significantly more problems than regular contact lenses, according to a report presented at the annual meeting of the American Academy of Ophthalmology. Extended wear contacts are special soft lenses that can be worn for periods up to 30 days, even while the patient sleeps. About 1 million people wear extended wear contacts in the United States. Many recent studies now show that repeated overnight wear of 30-day lenses can cause swelling of the cornea, the eye's clear window, which in turn can lead to infections and other eye problems. Patients don't have to avoid extended wear lenses, but those fitted with them should be checked by an eye specialist every 6 months, according to members of the American Academy of Ophthalmology. Next in the medical news is a breakthrough in the treatment of herpes. The government recently approved the first prescription pill to treat genital herpes, a sexually transmitted infection that affects 5 to 10 million Americans. The new pill will soon be available by prescription. The pill, to be marketed under the name Zovirax, could become one of the most widely prescribed drugs in this country. It will be used to suppress outbreaks in the 10 to 20% of herpes sufferers, 500,000 to 2 million people who have frequent bouts of herpes sores. Scientists state that people who have fewer than 6 outbreaks a year probably should not take the drug. The drug can also be used to reduce the duration and severity of initial herpes outbreaks experienced by about 300,000 people each year. Zovirax pills will cost about $2 per day. The company manufacturing the drug has said that pills will be accompanied by a warning that it shouldn't be taken for more than 6 months. Studies haven't determined its safety for longer periods. People interested in the drug should discuss its possible side effects with their dermatologist. My final medical news item tonight concerns a new combination drug treatment for acne sufferers. An acne treatment that combines tetracycline, a widely prescribed antibiotic used to treat acne, and ibuprofen, a non-steroidal anti-inflammatory agent, is giving new assistance to people with moderately severe cases of the skin disorder. Patients who took both drugs at the same time improved more than those who took only one of the drugs, according to a study by dermatologists at the University of Michigan. The study was reported in a recent issue of the Journal of the American Academy of Dermatology. For my health tip tonight, I have some true or false questions regarding sunlight and your skin. We all know about the dangers of too much sunlight caused by ultraviolet rays damaging the skin and leading to the future development of skin cancer and wrinkling of the skin. Let's review some other important concepts that are often misunderstood about the relationship between sunlight and your skin. For these questions, you will have to answer true or false. When sitting in your backyard or at the beach, many people feel that sitting under a beach umbrella will prevent sunburn. Is it true or false that a beach umbrella can prevent sunburn? The correct answer is false. The fact is that even if you remain in the shade on a clear sunny day, you are not protected from the burning rays of the sun. Although the shade may reduce the direct light that hits your skin, there is enough scattered and reflected light to cause a serious sunburn. True-false question number 2 concerns the effect of putting baby oil or moisturizing oil on the skin. Is the statement that baby oil spread on the skin will prevent sunburn and give you a safe tan true or false? The correct answer is false. Baby oil contains no ingredients to absorb or reflect the sun's dangerous ultraviolet rays. In fact, your skin can burn faster in less time with topical application of baby oil. Remember also that baby oils and moisturizing oils will not enhance the tan that you get either. True-false statement number 3 concerns the effect of sun on the skin of children. Children do not burn easily. Is this statement true or false? Think about it. Do you remember the way that the sun affected your skin when you were a child? The correct answer here again is false. The skin of a child is as sensitive to sunlight as the skin of an adult. In fact, children under 1 year, when exposed to the sun for the first time, can develop very, very serious burns. It's important to start sun protection as early in life as possible. The day after leaving the hospital at birth is not too soon to begin using sunscreens. My final true-false statement concerns the effect of weather on your ability to get sun damage. Is it true or false that it's difficult to burn on a hazy or cloudy day? How many times have you not worried about getting a sunburn because there were many clouds in the sky? Again here, the correct answer is false. On hazy, cloudy days, as much as 80% of the sun's rays penetrate the clouds and reach the earth. Additionally, the sun's rays can be reflected by the clouds and strike the skin from a variety of directions. Clouds also filter the heat-causing rays so that you feel cooler. This may encourage you to sunbathe longer, and consequently your risk of excessive sun exposure and severe sun damage will increase. Remember, the only way to prevent severe sun damage that sunlight can do to your skin is to use a strong sunscreen that can be purchased at your pharmacy without a prescription. It's never too late to begin using a sunscreen lotion. There's evidence now that we could all prevent skin cancer with the proper use of sunscreens. Now, on with the Medical Explorer. One of the most necessary and vital organs in the body is the kidney. We usually don't think about these specialized structures located in our lower backs until something disastrously goes wrong. When the kidneys malfunction, our bodies can no longer get rid of many waste products. With time, the waste will accumulate in the body and can cause death. Kidney dialysis can take the place of damaged or lost kidneys and has saved many lives in this country during the past 2 decades. Dr. Robert Polhemus is one of our area's leading experts in diseases of the kidney and in the specialty of internal medicine. Let's travel over to his Yuba City office now, which is located next to our area's most well-equipped kidney dialysis center, and explore the medical specialty called nephrology. First, perhaps you could tell us about the actual functions of the kidney. What does the kidney do for us?
Well, when the kidney is functioning well, and that's what I like to see, the kidney really is a very vital organ, and it's much more complicated than most people would realize. It's very much involved in controlling what we call in medicine fluid and electrolytes, and this, in simple terms, are things like water and salt and potassium,
right,
and minerals like calcium, and it's just critical to keeping the balance of these things in the proper proportions. If these electrolytes and chemicals are not in proper balance, it can have a very adverse effect on other organs of the body. Then the kidney is the thing that we think about the kidney most about is that it's an excretory organ and produces urine. And this is to eliminate waste products, mainly of protein metabolism. Chemicals such as urea, nitrogen, and uric acid and creatinine are eliminated in the urine. And if they weren't eliminated, these would build up to high levels, and the person would basically end up poisoning themselves.
These chemicals are things that might be in steaks, as an example,
well,
protein?
After the protein is metabolized by the body, correct.
Okay.
The kidney is also an endocrine organ. Most people really don't think of the kidney as an endocrine organ, but it makes a hormone called erythropoietin, for instance, which is very important in the production of red blood cells. It is very important in the metabolism of vitamin D, which many people really think of as a hormone, and vitamin D is very important in, say, keeping your bones quite healthy, and
firm and hard.
Right. And patients whose kidneys don't work often have problems with their bones. Also, the kidney is very important in the regulation and control of blood pressure. And when there are problems with the kidney, often people have problems with hypertension or high blood pressure.
So we have water and salt regulation, we have removing waste from the body, we have controlling hormones in the body for blood production and for vitamin D, and the last one was blood pressure regulation.
Correct. And then there are many more functions. For instance, many medicines that people take are metabolized and eliminated by the kidneys, and if the kidneys are not functioning well, medications that usually would not cause problems can build up to very high levels and be very toxic or dangerous for the person. So the kidney is really a very important organ, and as you'll see, when people lose their kidney function, they really begin to run into a lot of problems.
If one of the kidneys doesn't work, can the other one take over and do the job?
Very much so. Fortunately, there is a lot of reserve. Someone can live reasonably well with, say, 10 to 20% of normal kidney function. And this has important implications. For instance, if one of your relatives needs a kidney transplant, there's really no problem at all donating one of your kidneys, and your remaining kidney can take over the function, and there's really no problem whatsoever.
So we know that if one kidney goes bad, likely we could survive with the other one without much trouble. No problem at all.
No problem at all.
But what would actually cause two kidneys to malfunction?
Well, most of the patients that develop kidney failure and require some form of dialysis or renal replacement therapy have what we call systemic diseases, and these are diseases that involve many organs of the body, and they don't attack one kidney selectively. If the person has a systemic disease, it's going to attack both kidneys.
Is diabetes one of those diseases?
That's one of the very common causes of kidney failure, and unfortunately, people that have had diabetes for a long time, very many of them do develop kidney failure and make up a very large segment of the population on dialysis.
I see. How common is this problem of kidney failure?
Well, compared to other diseases such as coronary artery disease or disease of the heart, it's a very rare problem. But just to give you a ballpark figure, approximately one person in 10,000 will develop kidney failure to the point that they will require dialysis each year. And so in a community of this size of about 100,000, approximately 10 people per year develop kidney failure to the extent that they require dialysis.
These are new patients being added into the system. So
correct.
They still have the other people who are continuing to go on in this.
That's correct. And probably, I would say 40 patients in this community have had their kidneys fail or not, and are on one form of therapy or another.
What does a person actually feel when the kidneys fail? You don't have an all of a sudden pain or something like that. What goes on?
No, it's a very subtle illness, and it develops very slowly, and that in many respects is unfortunate because patients are often very far along or advanced before they really seek medical advice. And the reason is the symptoms are very vague. A person just lacks energy or is lethargic, isn't able to do what he used to do. He becomes anorectic or loses appetite and just doesn't want to eat. As it advances further, patients experience nausea and vomiting. Other physical signs, for instance, one that you might pick up, people tend to have lots of bruising because the kidneys, when they're not working, can interfere with the clotting of the blood, and people get a lot of bleeding into skin. Itching is a very common symptom of uremia. People become anemic, and this contributes to their lack of energy.
So basically, they could just feel miserable, just like
Correct.
and I've heard people say to me, "I'd feel like I want to die," and that's how miserable they can feel.
Correct.
And often then the diagnosis is made. And I'm curious, how do you, as a kidney expert, go about making that diagnosis? What do you have to do?
Well, in medicine, we follow certain patterns, and kidney disease or dealing with patients with kidney disease is really no different than what a doctor does who is approaching any problem. And the first step is to take a careful history and physical examination of the patient, and often, probably in 80% of cases, you really have a good clue about what is going on. And then you gradually move up to more and more sophisticated tests. But for instance, if you were talking to a patient that had diabetes for many, many years, and then you did some simple laboratory tests and found protein in their urine, and then some blood tests and had very elevated what we call creatinine and BUN, or these waste products that are normally eliminated, but when the kidneys aren't working, build up, you would probably be very close to the diagnosis. Sometimes it's not that easy, and we do, like in other fields of medicine, x-rays or ultrasound tests to measure the size of the kidneys. And sometimes, as a last resort, we need to do what we call a kidney biopsy, which is where a very thin needle is inserted into the kidney and a specimen is obtained and it's sent to the pathologist, and you can make a pretty precise diagnosis doing that.
But by far the usual situation is history, physical examination, and simple laboratory testing.
That's correct. For instance, since I've been here in town, I've probably only resorted to a renal biopsy about 4 times.
That's not that often, and that's very good. So people shouldn't be afraid to try to get the answer here.
No,
they should
that's
really
absolutely
go in and get
correct.
it checked out. Now, I'd really like to get into the area that we're going to really concentrate on tonight, and that's the area of kidney dialysis. What does that actually mean, kidney dialysis?
Well, dialysis really describes a physical process, and in simple terms, all forms of dialysis involve a membrane that is permeable to water and electrolytes or chemicals like sodium and potassium. And the physical principle is really quite easy to understand. You have a membrane and a fluid on one side and a fluid on the other side, and chemicals in high concentration on one side move down what we call the concentration gradient to the other side of the membrane. And we utilize this physical principle to remove waste products from patients whose kidneys don't work. And there are 2 forms of dialysis. One is called hemo meaning blood, and this is a process that takes place outside of the body, where the blood is removed and exposed to a membrane. And then the other process is called peritoneal dialysis, where we utilize a natural membrane in the body, the membrane surrounding the bowel.
Well, we're really going to get into this in great detail now, and I'd actually like to go over to the dialysis center and actually see some of the patients going through this. And I've just been informed that that's ready for us, so why don't we head over there and actually take a look at kidney dialysis?
Sure. Dialysis unit now, and Frank Wellman, one of my patients, has consented to let us watch him be dialyzed, and probably the first step is to insert the needles. And Mick Burrows, who works here in the unit, is now putting on a agent to clean the skin and make it sterile before we put the needles in. And what Frank has in his leg is what is called a vascular access, and this is actually a artificial tube that is hooked between Frank's artery and his vein. Most people have these accesses in their arms, but Frank has been on dialysis a while, and the sites in his arms have been used up, so he has this one in his leg. Now, Mick is putting in one of the needles into the access. And now he's eliminating all the air from the lines. And he's putting in heparin, which we use as a anticoagulant or something to prevent the blood from clotting in our lines and in the actual artificial kidney.
So there has to be one line going in and one line coming out.
That's correct. We call these arterial and venous needles. And what he'll be doing now is connecting Frank to lines which will be leading to the artificial kidney, which is this device right here. And this, as I described earlier, is, you can think of this as a membrane with the patient's blood on one side and a special solution which we call dialysate on the other side.
So that little device with the red bottom and the yellow top, that's the entire artificial kidney?
This is actually what we call the artificial kidney. This box here, we call this the proportioning system, and it also contains alarms and devices to monitor what is happening. But this is actually what does the work in terms of removing the waste products from the body.
Now that rotating device that we see on top of the machine, is that what's pumping the blood through?
That's called a blood pump, yes.
So it uses, I guess, just suction there to pull the blood through the tubing. We can see it going right into there now.
They actually compress, yes, it's the suction type principle. So the blood is going through the lines and will soon be entering the artificial kidney.
Should I be sick? Yes, you do. No, I feel fine.
It enters through the bottom?
Well, we call, yes. We'll turn this over. Part of what we're trying to do is, I think we're trying to make sure that no air is in the kidney and air rises to the top. As soon as we're sure that there's no air in the lines, we'll turn it over. It really wouldn't matter what position this thing was in.
So we've already seen some blood go in one side and out the other.
Correct.
It's already cleaning through there. Now, it will circulate through that many, many times.
Correct.
Is that correct?
This blood pump is set at about 200 cc's per minute. And when you consider that the patient is on 4 hours, that really adds up to a large volume. I haven't figured it out, but it's this blood volume probably many times. Okay, Merle has agreed to show us one of his exchanges, and I'd just briefly like to point out a few things. This is a peritoneal dialysis catheter, and it's permanently placed in his peritoneal cavity. And there are two special cuffs here that the patient forms scars around, and this is to try and prevent bacteria and other pathogens from working up the tract and giving him what's called a peritonitis, which is unfortunately the biggest complication of this procedure.
Does he have to use a needle like the hemodialysis patients do?
No, he doesn't.
Well, that's another advantage.
Definitely.
It would be to me.
Yes. Okay, I think if we're ready, we'll have Merle proceed with this exchange. What he's done is drain the dialysate fluid from his abdomen, and the hope is that the waste products that we want to have eliminated have accumulated in this fluid, and now they've been drained out of his body. And what he'll be doing in principle is putting in a new batch of fresh fluid that has no waste products in it, and then because his waste products in his blood are at a higher concentration, they will diffuse down their concentration gradient into this fluid. And then after the fluid has been in his abdomen for 4 or 6 hours, he will then remove it and repeat the process. And he'll do this about 4 times a day. And if you do this continuously, this is adequate in terms of removing the waste products from the body.
Since peritonitis, as you said, is a complication, cleanliness is extremely important, and I guess he has to start washing his hands just like any medical procedure.
Correct. Wash them for 3 minutes.
Well, now that your hands have been washed, what happens next?
I move over the table and place the bags side by side. I select the size of bag that I want to use depending on the amount of fluid I want to take off.
What Merle was referring to, when you use a bag with a high concentration of dextrose, this tends to draw more water from his body. And one of the other advantages of this technique, patients tend to be able to be much less restrictive in their diet and fluid intake. They can eat more of a normal diet, whereas patients on hemodialysis don't really have that luxury. They have to be very careful with what they eat and drink, because if they drink too much, they become volume overloaded and they can develop congestion in their lungs and real breathing problems. So this is one of the real selling points of this type of dialysis.
Okay, I've opened the prep kit, which has everything in I need for the change. I have to mask during the procedure to prevent infection. Take back the medicine port where the spike will go. take off the adapter or the cover for the previous one, clamp it, pull the cover off, and change the spike.
This little cap has betadine in it, which is designed to kill any bacteria that might be there, and again, another measure to try and prevent peritonitis.
Done. All I have to do is drain in. This morning I used a 1.5 because I was down to my dry weight, and this afternoon I'm using a 2.5.
Dry weight is a concept we use in nephrology and refers to the weight of the patient that you consider to be ideal when they're not excessively filled with fluids. And that patients weigh themselves, and if they're over their dry weight, then they use one of the bags with a higher concentration of dextrose to pull off extra fluid. Although Mr. Altaffer is not a diabetic, an interesting concept that's evolved with this technique. People with diabetes now put their insulin into these dialysate bags, and they deliver their insulin intraperitoneally, which is actually much more physiologic, and they can achieve
more natural.
Yes, and they can achieve really excellent control of their diabetes, and they don't have to stick themselves to give themselves insulin. So that's another bonus of this technique if you happen to have diabetes.
Again, I would like to thank Dr. Robert Polhemus and the staff of our area's dialysis center for allowing the Medical Explorer to observe his life-saving procedure. Special thanks must be given to his dialysis patients who gave up their privacy to tell us about their experiences with kidney dialysis and kidney failure. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology and allergy office in Yuba City with your suggestions for areas and people that you'd like to see on this program. The Medical Explorer, as you know, is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at the Skin and Allergy Center of Yuba City at 367 Del Norte Avenue, 95991. In my next program, The Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City and Marysville area. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.
Area.